Hi, welcome to our channel, Mrcp made super easy. Today we'll be looking at another topic. We'll be talking about celiac disease. Let's get into today's celiac disease lecture. At the end of today's lecture, I have also included questions from past medicine through the Anki flashcards, so you get an idea of what the flashcards are all about. So you guys have an easier understanding, and you'll be able to use it in a better way. So let's talk about celiac disease. Well, when I say celiac disease, you need to remember gluten. Gluten is evil. You are supposed to be scared of gluten. If you are someone who's suffering from celiac disease, you look at gluten, you run miles away from it. So gluten is the evil person over here. So remember celiac disease, run away, it's gluten. Right? So let's get into that. So now it is an autoimmune condition where the patient is increasingly sensitive to gluten. Now I have this picture included. Now there are a lot of things in this picture if you see. Now what this picture is all about, we will understand that in a little while. Basically this picture will summarize our entire lecture. So we will come back to it in just a bit. Right? So now if you look at the pathophysiology of this, now what is happening is basically when somebody is exposed to gluten, now it is an autoimmune disease, it has association with autoimmune disease, namely dermatitis herpetiformis, diabetes mellitus type 1, and autoimmune thyroid disorders, IgA deficiency related disorders. So there is infiltration of the lamina propria by the T lymphocytes. When the lamina propria gets infiltrated by T lymphocytes, it activates the T cell mediated cytotoxicity, leading to killing of the enterocytes. Look at here, somebody is screaming to kill that evergladin, and somebody is screaming that they end up killing up the enterocytes. So damage to the enterocytes causing blunting of the villi, leading to malabsorption. Malabsorption will produce symptoms like diarrhea, failure to thrive, nutritional deficiency, iron deficiency anemias, weight loss, etc. So if you look at the condition associated, the most important ones are they are associated with HLA-DQ2 and HLA-DQ2 and 8. Now this is something you have to remember, right? So the first condition is dermatitis herpetiformis. What is dermatitis herpetiformis? Now it is quite simple. It is basically itchy, pruritic, vesicular eruptions all over the skin. Look at this person's back. Okay, it can even happen on the flexor compartments. It can happen over the back, multiple areas of the body. So these kind of lesions will be there. If you have a patient presenting to you with such kind of lesions and there is a diagnosis of dermatitis herpetiformis, rule out the possibility of celiac disease. The second most important condition, autoimmune thyroid disorder. We need to remember this. Dermatitis herpetiformis, autoimmune disorders, thyroid disorders, diabetes mellitus type 1, and first degree relatives. Right? Association with HLA-DQ8, HLA-DQ2. HLAs we have two, DQ2 and DQ8, and the conditions most important, dermatitis herpetiformis. You got to remember that. What is dermatitis herpetiformis? Vesicular pruritic skin eruptions over the body. Don't forget. Then autoimmune thyroid disorder. What else? Diabetes mellitus type 1 and first degree relatives. Right? Never forget. HLAs, DQ2 and DQ8, dermatitis herpetiformis, autoimmune thyroid disorder, diabetes mellitus type 1 and first degree relatives. Now let's look at the signs and symptoms. The picture is quite self-explanatory. You will have features of malabsorption syndrome. So you will have diarrhea. Well, you're losing electrolytes, so you're going to become fatigued out. You're going to be scared of eating things. You're going to have weight loss because whatever you're eating, right, that's going to be a problem. Malabsorption, if you're going to have diarrhea, body is not accepting food, you're going to vomit it out. If you're going to vomit it out, your muscles will undergo spastic contractions, you're going to have abdominal pain. As a result of your poor diet, children will suffer from failure to thrive, and also they will suffer from nutritional related anemias. So if you have celiac disease, you will have features of malabsorption, you will vomit, you will puke, you will have diarrhea, you will have weight loss, you will have joint pains and abdominal pain as well. Right? So that's another thing. Next thing we look at is the complications. Now, in order to remember this complications, I have come up with a mnemonic which is called as OP Guide. For those of you who don't know OP Guide, it is a textbook of pediatric medicine which was used very commonly in the Indian medical setup. So, O stands for osteoporosis and osteomalacia, P for peripheral neuropathy, G for gastrointestinal symptoms and also GI malignancy like T cell lymphomas. Next, we have something called as hyposplenism, functional hyposplenism. The other thing we have, A stands for anemia, mainly iron, folate and vitamin B12 deficiency anemias. I stands for infertility, subfertility, recurrent miscarriages and intolerance to lactose. Right? So complications is OP-GAI, O for osteoporosis and osteomalacia, P for peripheral neuropathy, G stands for gastrointestinal symptoms like malignancies, namely T cell lymphomas, H for hyposplenism, A for anemia, mainly iron, folate, vitamin B12 deficiency, I for infertility, subfertility and intolerance to lactose along with miscarriages. Now how do we diagnose this? There are two ways to diagnose. NICE has put up a guidelines in 2009. There are two ways to diagnose this condition. One is a jejunal biopsy, the other one is immunology. Now what happens in the jejunal biopsy? Now I have a picture over here. This is a healthy tissue and this is a celiac disease. Look at the villi. Such beautiful villi, right? They look beautiful. Look at the villi over here. They're all flattened out, right? Look at their shape over here. They all are smiling and happy and beautiful. But look at them. They're all flattened out. Their morale is down. They're out. And look at the crypts over here. The crypts are shallow. And the crypts over here, there are long and heightened crypts. So we have crypt hyperplasia. Basically, the crypts are becoming longer. And from the above, we know that there is infiltration of lamina propria by lymphocytes or T cells. Right? So as a result of that, the intraepithelial lymphocytes will be raised. If you look at the immunology, now this is important. Immunology, when you look at, if you want to remember how immunology is, you need to know that somebody who has celiac disease, well, they are drinking tea. So TEA. T stands for tissue transglutaminase antibody. You need to remember this. This is a question. This is the first choice when you're testing someone for celiac disease. The second is E stands for endomysial antibody, which is again IgA component to rule out IgA deficiency. And the third is anti-gliadin antibody, although it is not recommended by NICE. So now next is the treatment part or the testing. Now we need to remember one important thing. This is a question. If you are testing someone for celiac disease and they are already on a gluten-free diet, we need to reintroduce gluten 6 weeks prior to testing. Remember that, it is a question. They're going to ask you and they're going to test you for this. Next we look at the treatment. We already know that the problem here is gluten. So you need to have a gluten-free diet. So you need to avoid things that contain gluten, namely wheat products, all the things that you eat and enjoy, pasta, pastries, bread, oats, rye. And the other important thing is, since they are suffering from hyposplenism, we need to offer them immunizations with two important vaccines. Give them a pneumococcal vaccine, follow it up with a booster dose every 5 years, and according to different individuals, offer them yearly influenza vaccine. So that's the treatment. Very simple, right? Now let's look at the summary above of what we just studied in the picture. So we learned that it happens from gluten. So there is gluten sensitivity, right? Gluten sensitivity association with diabetes mellitus type 1, dermatitis herpetiformis, IgA deficiencies. So complications can occur: gastrointestinal malignancies, T cell lymphomas, osteoporosis. If we do for diagnosis, we are looking at jejunal biopsy, where there is T cell lymphocytic infiltration leading to cytotoxicity, killing of the enterocytes, blunting of the villi, leading to malabsorption, features diarrhea, steatorrhea, nutrition deficiencies, weight loss and failure to thrive. Association with HLA DQ2 and 8. Important antibodies, the T drinking TEA, T for TTG, which is the first choice antibody, first followed by the gliadin antibodies, right? So, right, gliadin and endomysial antibodies, right? There is first degree relatives, so genetic predisposition is important component. Treatment is dietary restriction of gluten. Refractory cases, steroids can be offered and immunosuppressants in the form of azathioprine. So remember that picture, it is self-explanatory. So now we look at the questions. Now this is what an Anki flashcard looks like. Now these are the kind of questions you're going to ask. If a patient is already taking gluten-free diet, they should be asked, if possible, to the following. The answer is reintroduce gluten for at least 6 weeks prior to testing. They will ask you about the villi. Now, if somebody is already suffering from celiac disease and they are on a gluten-free diet, what are the following things can happen? One of the options will be there is a reversal of villus atrophy and immunology. The other thing is about the vaccination, offering vaccination to the patients. So there are two, pneumococcal and influenza. First choice antibody, they will ask you. The answer is tissue transglutaminase antibody. And the management of celiac disease, gluten-free diet. So that's going to do it, guys. In our next lecture, we'll be talking about the Ballard of factor VIII. I'll tell you what that is about. So if you like my video and if you got something out of it, do share, like and subscribe, so it will be helpful for other people as well. And since we are doing this from an exam point of view, I'm not going too much into the details of our lecture today. So if you want to understand this in a better way, do let me know and I'll post a lecture accordingly. So thank you and keep watching MRCP made super easy, and keep studying, keep revising. Until next time, take care and goodbye.